Hi, everybody. This is Dr. Tianjun Wang from London. Thank you for the invitation from World Traditional Medicine Forum. My report topic is brain fog of long COVID-19 and acupuncture treatment. Last year, quite a well-known journal called Natural Medicine published a very important review called Post-Acute COVID-19 Syndrome. From this review, we can see there are lots of post-COVID symptoms or diseases are out of the now. Brain is one of the important organs involved. In this review, one of the special symptom called cognitive disturbance or brain fog, published on this international value journal. Maybe brain fog after COVID, it looks like a new term for many of our academics, but actually it is not a new. Neurological disorders, particularly cognitive disorder, have also been reported in patients who had a mildly or moderate form of COVID infections without hospital admission. Many patients who have suffered from acute COVID infections have long-lasting symptoms affecting several organs, including the brain. So if we say this, the long COVID status can include brain fog and the cognitive deficits that can disturb activities of daily life and can delay completely recovery. So more report has been focused on post-COVID. One of the typical sample is brain fog. So as we mentioned, brain fog is not a new. Cognitive impairment has been noted with or without fluctuations, including brain fog, which may manifesting as difficult with concentration, memory, receptive language, and or executive function, feel confused or disorganized, or find it hard to focus to put thoughts into words. So these kind of symptoms are quite common in our general practice, and particularly in the area of neurological or psychological diseases. So brain fog isn't a medical condition. So maybe for our medical training, maybe we're not so familiar with this brain fog. It's a term used for certain symptoms that can affect the ability to thinking. So the patients they may report their brain looks like a fog, or not clear, very vague. So, but if we search on the medical academy, we'll find that brain fog has been described in many academic papers many years ago. But because they are not so a lot of medical terminology and not so common in other general conditions. So they are more commonly understanding after COVID. This kind of brain fog is a partly of the brain symptoms, but how COVID-19 affects the brain? We all know COVID-19, this virus is known to penetrate the olfactory mucosa, causing loss of smell and may enter the brain, migrating from the cribriform played along the olfactory tract or through a vagal or trigeminal pathway. So this virus could pass the blood-brain barrier, BBT, because inflammatory cytokines include induced BBB, instability, or viral myositis. So that's the reason why COVID-19 can affect the brain. The virus can pass the blood-brain barrier. So from Western medicine perspective, the moment many of our colleagues has already understanding, we have seen many similar patients, but on the Western medicine aspect, there is no suitable treatment for brain fog. So many patients, they try to contact them medics, but unfortunately no treatment for them. So then they tend to try to find TCM acupuncture. But from the TCM acupuncture aspect, how to understand brain fog? In the literature of TCM, as we know, there is no such term as brain fog. Brain fog, you know, it's not seen or described in our traditional TCM classic. But there are some similar symptoms, including forgetfulness, dizziness, absent-mindedness, etc. The understanding of brain fog in TCM is still relatively new. After search on Chinese medicine database, such as the biggest one, CNKI, or in Mandarin we call it Zhiwang, there's no research on it. So far, particularly in the Chinese the journals in China, there is no any report at all. But overseas TCM practitioners have the opportunity to treat COVID and long-COVID, including brain fog. About 70 or 80% long-COVID patients have brain fog symptoms, which is basically consistently with relevant overseas literature's reports. In the in Western literature reports, including lots of clinical observation review, they all have the similar report. According to TCM, it can be considered that the disease location is mainly in the heart, kidney, etc., involved liver, spleen, lung, and other visceral. With treatment of, you can use Chinese home medicine, can use acupuncture, etc. Many of our colleagues have lots of experiences on treating brain fog. But today, my report will focus on brain acupuncture theory, guidance, the treatment of brain fog. Let's briefly review about the TCM brain science. The first, we'll say, the result of TCM science, or you can say the first developed area of TCM brain science is TCM has brain. Although in so far the mainstream TCM classic used the 5-element cycle and the Zangfu organs, such as Zang organ, Fu organ, and extraordinary organs. On this system, brain is only one of the extraordinary organs. Brain itself has no meridian, brain itself has no pattern, etc. But now, with development of TCM brain science, more academic believe TCM has brain. And the brain functions. The brain is so important. The brain functions. The brain controls the life and the mental activities. as brain is so important, it is one of the Zhang organ, even higher than other Zhang organs. The brain has its own channel. After research on many literature, the literature review and the clinical trials, now more believe Duma or governor vessel is the channel of brain. Sometimes even we call them brain meridian. The basic foundation of TCM on brain science is brain is the seat of marrow. Its qi transfers to the top of scale and lower the Fengfu Duma 16. As you know, this statement is originally from the Huangdi Leijing Ling Shu Hai Lun. So based on this, the references, nowadays more focus on the scalp acupuncture and the Duma Daoqi technique. These two are the unique and most effective methods to treat brain-related conditions. From the right-hand side, the brain, the meridian Duma, we can say the Duma channel distribution. We can see there is the branch or the channel start from the Duma 16 Fengfu entered the brain. With the development of TCM brains and the brain science, now according to the brain acupuncture, brain fog we believe brain fog is located in the brain. It involved the heart, kidney, liver, spleen, lung, and other organs. Based on clinical research, common patterns and the main treatment for brain fogs, we can summary here. Brain marrow, marrow emptiness, including brain fog, tinnitus, dizziness, etc., etc. We can choose majorly about on the Duma point, such as Du Tun Tui Bai Hui, X point 4 Shen Chong, Duma 16 Fengfu, X point Bai Nao, Duma 14 Da Zhui, Duma 4 Ming Wen, etc. We can also combine with scalp acupuncture, acupuncture. The next pattern of brain fog is brain yang qi deficiency. Yeah, the patient's main symptoms, including brain fog, depression, insomnia, forgetful, body chills, hand and feet are not warm, easy, fatigue, cold, etc. We can choose the Duma point. And brain fog for patterns and other patterns are including brain spread disorders, the brain fog, the depression, anxiety, irritability, insomnia, lose appetite, etc., etc. And also brain the collaterals and obstruction. Yeah, this obstruction can cause the not only brain fog but also headache, also hemiplegia, central facial paralysis, aphasia, pain or numbness. Of course, we can choose the Duma points and to treating this kind of condition as well. We always can combine with electroacupuncture and scalp acupuncture. In terms of the scalp acupuncture treatment for brain fog, I list several of the commonly used scalp acupuncture areas, and such as the first one, we can use the sensory area. This is a line from the top to the side of temple. They can treat sensory disorders of the contralateral side. It can be divided by 5 equal parts. Different parts can have the different indications. And also we can choose the foot motor sensory area. Yeah, this is the area on this chart. And we can choose the vertical auditory area, also called auditory area. Yeah, this is just above the ear. This area, scalp area, are mostly used for the dizziness, deafness, tinnitus, Meniere disease, and the brain fog, etc. We we mainly choose the most commonly used area called the spirit emotion area. Yeah, this is the completely new area for mental disorders. They are not so commonly explained in most of the textbook, even the first edition of the TCM Acupuncture book. So this is completely new, and hopeful that we may use this special power for the treatment. And another new area called the nose, throat, mouth, tongue area, or simply called head area. This area is exactly on the front head, and on the middle line, partly of Dume. This area covered of the Dume 23 and we call it Shangxing, and Dume 24 Shenting. And in terms of the Dume points, as we mentioned, the brain is the sea of marrow transferred to the Dume 16 Fengfu, and we summarize Dume is the channel of brain. So we may mainly use Dume points for treating brain fog and other brain disorders. And in these points, Dume 16 is a typical sample. We may use this. For Dume 16, we use Dao Qi technique, which means we insert needle in a certain depth according to the size of the body. Most of the cases, we choose the depth for the thin people, around 27 millimeter. For the middle-sized people, about 30 millimeter, and for the big people, we may choose the 35 millimeter for the depth. Then generate the special technique called Dao Qi technique, which generates slowly and gently and smoothly leading generated qi movement to the brain and a certain part of the brain. This is a commonly used Dume points, most commonly used points, and especially power point for the brain conditions, including brain fog. And finally, I'd like to share a special case study to explain the treatment for brain fog. A male patient, British, is 33 years old. From January 2021, he was confirmed with the Delta and the COVID-19. After 2 weeks, he was tested negative, but still suffering from brain fog, anxiety, chest pressure, palpitation, fatigue, energy level only 1 to 2 out of 10. And only less than 1 hour activity should lie down, stop it. He has to stop his business, lost confidence, hopeless, etc. And he got lots of tests, MRI, EKG, blood tests, all negative. And from the AH system has no any treatment. From middle April 2021, he came to see me. I mainly use the TCM Acupuncture plus Psychologic and the mainly central area, spirit emotion area, thoracic cavity area, plus Renmai 12, Renmai 6, etc. And only used 1 week of the herbs because he refused to use more herbs. After first treatment, the patient, the sleep getting much better. He said that his brain getting clear, his energy level up to 5 to 10. After 3 sessions, improved 80% treatment twice per week, then once per week, once in 2 weeks. And interesting, this case was published by China Daily on 24th September 2021. He was interviewed by the journalist. We can see this publication on the last year with a name called British Turning to TCM to help treat COVID-19. Yeah, this is the real case. And yeah, the last slide I'd like to share is it's a book called Acupuncture for Brain, a treatment for neurological and psychological disorders. In this book, has listed how to use the brain theory and the brain technique to treating neurological and psychological diseases. This book can be in reference for colleagues to use to treat brain fog, including the detail of the scalp acupuncture location, indication, and the Dongmai Daoqi, and all these diseases. And let's say a short summary. The increasing evidence indicate brain fog post-COVID-19 is wide and severe. TCM has worked very well against post-COVID syndrome. For brain fog, acupuncture and general acupuncture, traditional Chinese medicine, herbs are all benefit, but the acupuncture brain theory and the techniques will play a vital role against the brain fog with more effective and quicker and better. Okay, this is my report. Thank you.